My name is Aimee Riley. I am an orthopedic surgeon and I've specialized in hand surgery. I mostly find my clinics mostly in the Asheville and Arden location, but I do have a satellite clinic in Waynesville as well. What got me into the medical field was I was a personal trainer after college and I found it a rewarding career, but I didn't find myself being challenged enough. And so after having some experience with some orthopedic injuries as a collegiate track athlete, and with my partner, Dr. Hedrick, treating me here and allowing me to see some of the world of orthopedic surgery, it inspired me to become an orthopedic surgeon. So that's why I made that decision to go to medical school and then ultimately pursue a career in orthopedic surgery. So what got me into hand surgery was after considering multiple specialties that I could choose in residency, I kept gravitating back towards hands because there was a variety of care that I could provide. There's a lot of injuries that happen with hands, and even a little problem can become a big deficit in regards to day-to-day function, whether it's at work or just with hobbies and sports. And so for me, being able to treat hands is very gratifying because I can see patients get back to those things that they enjoy, even after a devastating injury or a simple injury or even arthritis that affects their day-to-day function. My favorite part about being at EmergeOrtho is I get to work and function and treat the patients in Western North Carolina, and that is where I grew up. So I was born and raised in Asheville and was raised in the Western North Carolina area. So for me to be back in the area treating the patients and people that I grew up with and their parents and now their children, it's very gratifying. And I also like being a part of working alongside the people that mentored me. So as I've mentioned before, Dr. Hedrick was a provider to me, but also a mentor and helped inspire me, getting me into the orthopedic field. What I think is most unique about EmergeOrtho is we have very qualified subspecialists. So even though as a hand surgeon, I may not be the best person to take care of your knee, I have partners that I can refer to for your knee pain that are extremely qualified and provide the best care. And so working together as partners for the best care for patients, we are able to provide that quality care for no matter what body part is injured or is having trouble. Most of my surgeries are done on an outpatient setting, most commonly in an ambulatory surgery center type setting. So patients come in for surgery, they go home the same day, which is nice for patients because it generally has a lower cost of facility and lower cost to the patients for their surgery. In my free time, I find myself training for triathlons with my husband. So we're always constantly finding ways to find a place to go swim, bike, run, race. And so it's a challenging sport to do in addition to having my medical career, but I like the challenge. So it's a fun way to see the world, and I enjoy doing that. One of the things that I just really enjoy about hand surgery is I treat a breadth of ages of patients. So sometimes I see children that are 2 years old with a trigger thumb, and seeing them get through that issue, even if they need surgery, and back to leading a normal lifestyle. Likewise, on that same day, I might have a 97-year-old patient come to my clinic for a broken wrist. And so it's a very diverse population that I treat, but it's also very rewarding being able to treat that spectrum of patients in a single day even.